everything except for Instagram as of this second. So we'll see.
What's wrong with Instagram?
We don't know yet. We're about to find out.
Oh,
Maybe nothing.
okay.
It's just it hasn't loaded yet.
Hello, everybody. Welcome to Fertility Fact or Fiction. I am your host, Dr. Rahi Victory, and I am a double board certified reproductive endocrinology and infertility specialist. I am here with my currently very occupied friend, Dr. Tarek Ibrahim, doctor in name only. He does not have certifications, although he keeps being identified at various social events as, are you Dr. T?
I'm identified as Dr. T.
I love that. That is too funny. So we have a special guest on with us tonight, and we will introduce him shortly. And he has an interesting product to talk to everyone about. However, before we get there, I would like to take this golden opportunity to review what can only be called a incredible summary of all the years we've been doing this in one journal. So Human Reproduction. I think you're indicating that Instagram is working now. Is that right?
Everything is awesome.
Okay. So Human Reproduction is a very famous fertility journal in the top two. So you've got Fertility and Sterility and Human Reproduction. Fertility and Sterility is really more American. Human Reproduction is European, but they're both wonderful journals. And so there's a whole bunch of articles in here talking about various, different things that we've been saying or doing for years. One is about offering intrauterine PRP. They actually say there is evidence to support it, but they're not convinced 100% with the evidence that they have. So they're saying that that's something we should look up. They're talking about how the THC and CBD affect the sperm channel or calcium channel, in sperm. And that has a very negative impact. Reason why we've been telling guys to stop using marijuana for, 20 years now. They have another one on whether or not your adenomyosis actually impacts your success rates. And in this study, they actually looked at live birth rates following a transfer in patients that have adenomyosis. And I won't even get into the whole topic, but I will say that the summary is women with adenomyosis matched with controls for age, blastocyst count, and top quality blastocyst count exhibited reduced live birth rate following IVF ICSI treatment. So for all those doctors that say adeno doesn't matter, endo doesn't matter, here is yet another study, just happens to be recent, that is saying that it does matter. And it gets better. High estrogen levels on the day of frozen blastocyst transfer are associated with increased early miscarriage rates in artificial cycles using transdermal estrogens. In other words, why we've been saying for all this time, don't do hormone replacement therapy cycles because your estrogen levels are sky high. That's why you want to do the cycles with letrozole where your estrogen level is low, which is why letrozole gives you the lowest risk of miscarriage. And later into the pregnancy, there's also increased risks of preeclampsia, stillbirth, things like that as well. This is just one. And finally, the coup de grace. They presented data from the HFEA, which is the Human Embryology and Fertilization Authority in the United Kingdom, where I just was for the weekend at the amazing British fertility show. And they talked about whether one embryo transfer at a time or a double embryo transfer is better. Now, we have always said avoid double embryo transfer unless you absolutely have to. Single embryo transfer is better. And in this study, they actually demonstrated that 2 sequential embryo transfers has either the same success rate as a double or even a higher success rate than a double embryo transfer. So avoid those doubles. It's much better if you go for it with a single embryo transfer. So we were really excited about that because all of those are just from this current journal article. And we've been preaching that stuff for years. So very validating to see all of that. And I have to say, it's kind of nice to be 5 to 10 years ahead of the curve. So very cool information that we found here. Very exciting stuff. Quick chat. We were just in the United Kingdom for all those that attended the British Fertility Show. The London Fertility Show was an incredible meeting and lots of incredible people there. Had a great meeting with several people that are interested in working with us. Got the opportunity to give some hopefully well-received talks there, and posted lots of stories and feedback from some of the other attendees and exhibitors and so on. So great opportunity. Love being there. Very excited to get my UK license so that we can start a VRC London very, very soon. So we should know quickly.
If you get a UK license, does that mean I get
You get
a UK,
license? You can have as many fake licenses as you want.
All right, great. Well, guys, you'll see me there as well then.
Yeah, we will need to take Tarek out there to do the social media stuff for us. So very exciting time. Had a great weekend. Huge thanks to my wife who attended as well, and especially to Lisa who was there with us, manning the booth, setting up the conference, arranging for everything, getting my talk times and all of that. Really great opportunity. So with no further ado, I would like to introduce Patrick Zhu from Mr. Fertyl, spelled Fertyl, who is here to talk about a very interesting product. And I was ready to kind of present some challenges, but I looked up all the information that he was presenting, and it actually is all true. So I was kind of excited about this topic. And we're going to have him chat briefly about what he has and what he does. And if anyone has any questions, you're welcome to ask. Just for full declaration purposes, I have no financial involvement with Patrick. I don't get a piece of anything he sells. He's just here because he was interested in coming on our show and talking about what he has. And we'll give anybody who wants to be on the show an opportunity if they have something that's got, value for our patients and our clients. So Patrick, welcome to the show.
Hey, everyone. Thank you, Dr. Victory. Thank you for having me on. Same with Tariq as well.
My pleasure. Good to have you here. So tell us a little bit about what Mr. Fertyl produces and sells currently, and then tell us a little bit about how you got into this and what made you think this was something you needed to explore.
Yeah, absolutely. So starting out, we offer fertility-focused underwear. So specifically boxers for now. We are going into briefs soon, but a little bit about how I actually had the idea for it. So I actually had a coworker, and she is more or less infertile and wasn't able to conceive naturally. And she would always tell me about healthy swaps that she would make for her food or her lotion, moisturizer, shampoo. And that really got me going because, again, I'm 24 years old, so fresh out of university and off living by myself, wanted to start making some healthy adjustments in my life as well. So that really stuck with me. And I went home and essentially went through everything that I use, from the shampoo that I use for my hair to my moisturizer that I put on every single day. And I got to my clothing, and I kind of put two and two together because not only was there chemicals that go into the actual fabric itself, but there's a huge fertility crisis. So once I started looking into this specifically, it was pretty alarming, right? With sperm counts decreasing 50% in the last 50 years. Yeah. One in six couples, not individuals, right? Couples cannot conceive naturally. And then understanding the actual solutions to it, right? So instead of a one size fits all cure per se, right? It's more or less something where worst case scenario, IVF, right? In vitro. And that, depending on who you are, it's very, very expensive, right? It could range from $12,000 to $15,000. Again, I'm based in the United States, so talking in USD, but some of the influencers that I'm speaking with currently, they've gone through 6 to 7 cycles, right? So just using 15 grand as an example, 7 cycles, that's $105,000. Now, for most people, they don't have that type of money, disposable, right, liquid money, to be able to spend on something like this, even as important as conception, right? Because again, this is something that not only is this a problem, but the way I see it is this is one of the most beautiful things you can do in your life, right? When we talk about, religion and everything, God put you on this planet and you were able to use your time to conceive and have children and bring more life into this planet. And I think it's a very beautiful thing. And not being able to do it naturally, I think is, it's a shame. And I think that more and more people are slowly understanding what's actually going on and being more health conscious, right? We do see a huge shift in people being aware of the problem itself. And because awareness is the first stage, they're starting to make some healthy swaps from everything that they put in or on their body, right? Because again, not to talk about food, but that's also a huge issue as well, right? And I know that currently our administration in the US here, they're actively working on making sure that everything is as safe as possible, right?
Yeah.
So this goes for everything holistically, from food to the things that you put on your body, right? From skincare routine to shampoo to clothing, right? Any and all things. And that's where we really come in, because we do understand.
Yeah. So what made you decide specifically to focus on underwear? And then why did you decide to make it out of the bamboo base that you have?
Yeah, absolutely. So for us specifically, I measure, so I've always wanted to be an entrepreneur for one, and just understanding that, yes, the money is involved, but it's all about impact, right? And when I see a big problem like this, I don't think that people understand how big this problem really is, with everything going on from microplastics to the toxins that are in normal clothing, and just being able to do something about that, right? I think Mr. Fertyl is a brand that will grow awareness to it. And specifically for underwear, there's a lot of different things that we can make, right? We could make supplements for omega-3s, right? Which are fantastic, high DHA, right?
Yeah.
EPA combo, fantastic for sperm health quality, right? Or we can go and make other things, right? Like bedding and bed sheets. But, when it comes to underwear, this is something that touches your most sensitive area every single day for 16 plus hours. Sometimes, right? Some people, they don't sleep in the nude. So they're wearing it 24/7, right?
Right.
So this is something where it's
hopefully not the same pair, but yes.
Hopefully, of course, right. But it's just something that's low impact switch, but it makes all the difference, right? And again, I did want to stress that underwear is not going to solve this entire fertility crisis, right?
No,
that is right. It's not a one size cure for everything. But again, what Mr. Fertyl stands for, so we stand for fertility, and we promote all the healthy things that everybody should do, right? Being able to eat clean food, that's a big one. Get enough sleep, get enough sunlight, do exercise, right? Maintain your stress levels, but all the while offering a complementary product. And of course, we're going to expand to other things as well. I'm not planning on selling underwear my whole life, to be completely honest with you, right? But it is just something where instead of, I want to be able to make a change, right? Help people where it really matters. And again, I only go after problems, and I see a serious problem here. So, yeah.
So I know you are using bamboo as the base for your product. Is that right?
Right. Correct. Yes.
Yeah. And I looked into this, and so there's no question that, I think most guys are in cotton. I haven't seen a lot of bamboo before, but it is very kind of light and breathable, which was interesting because you did send me a sample pair. And so it's actually extremely comfortable and barely feels like anything's on. The more interesting thing was, and I saw it on your website, that there's a piece, I think it was a quote from a physician, a urologist, who said that things like polyester can actually be quite negative. And I looked at that and I was like, what? That doesn't make any sense. But when I actually looked it up, there's actually evidence where they took dogs, and this was very wild for me to read, and they put them in underwear for 2 years. So they had, I think, close to 30 dogs, and they took 1/3 of them and they gave them no underwear. They took another third and they gave them polyester underwear, and another third and they gave them cotton underwear. And in the no underwear and the cotton group, they actually had no change in sperm performance, no change in testicular performance. But in the polyester underwear group, of course, granted it's in a dog, but nevertheless, they actually had damage to the testicles, and there were significant changes in terms of sperm quality as well. And the guy that authored the study, who you quote on your website, actually believes it's because of the electrical charge that's built up as well as the dissipation of heat. So the bamboo is really great, I guess, because it's letting things be breathable and you're not carrying any charge. Is that the reason you chose it?
Yeah, it's definitely one of them. So bamboo in itself is not only extremely sustainable, but it's also something that is incredible fabric that's not durable, high quality, very soft, right? But then when it comes to actual reproductive health, it's extremely breathable. It's hypoallergenic naturally. It's antimicrobial naturally as well. And then it's also heat regulating, right? And there are a few different fabrics that we did choose from. So there's organic cotton, there's organic silk, there's bamboo lyocell, of course, what we use, and then wool, alpaca wool, and so on and so forth. But bamboo really took the cake for us because it's not only extremely durable, but it checks all the boxes for reproductive health, right? And I know organic cotton is a very big one as well, where it's very non-toxic, which is fantastic. But the reason why we chose bamboo lyocell over it is because it's not only feels better. I'm sure for those that do have our underwear, they'll definitely attest to this in terms of the softness and quality. But in terms of the sustainability aspect, so that's another thing I would love to touch on, just in terms of how sustainable bamboo really is. And it's something where traditional cotton, there's a lot of pesticides, insecticides, and fertilizers that go into the actual growing of the crop. And then turning it into the actual usable textile fabric, there's even more chemicals. For bamboo, specifically ours, right? Because there is bamboo viscose. We can get to that in a second if you would like. But bamboo lyocell specifically, it's grown organically. So bamboo doesn't need any pesticides, fertilizers, or chemicals. And then on top of that, making it into the actual process from wood pulp or bamboo pulp into the actual textile fabric that's usable for clothing. It's in a closed loop system. So what that means, it actually reuses 99% of all inputs. This is a big staple of our brand. That's what we care about, right? We not only care about fertility, we care about global health as well, not just individual human health. We care about global health. And again, bamboo lyocell really takes the cake. And the thing that I did not mention yet is the water consumption, right? Cotton, traditional cotton, and even organic cotton, right? This is what separates organic cotton from bamboo lyocell. It's how water intensive the process really is. And because of that, it's grown in certain areas of the world where it's not essentially fertile for growing of crops, right? So we can think turkey, for instance, versus bamboo, where it uses natural rainwater. It can grow upwards of 1 meter per day, depending on the species, which is incredibly fast, highly renewable. And then being able to actually turn that into a usable fabric is fantastic. And again, minimal water usage, right? There is a lot of water that goes into normal cotton production. I forgot the exact stat, but I believe it's like if you have one cotton t-shirt, it equates to about 3 years of drinking water for one single person, which is a ridiculous quote, right? I've never heard that before.
Wow.
But it's one of those things where I saw it and I was like, wow, like that's staggering. I believe that's on our website, but
it's going to have a huge environmental impact for sure.
Absolutely.
So your product is available now. People can access it if they want it. And where do they go to, kind of look at this?
Yeah.
What's your website?
Yeah, our website's just mrfertyl.com. So MRFERTYL.com.
And how much do these undergarments cost?
Yeah, so they are $40 per pair, but most people actually buy a pack, which is great. So we do offer free shipping at 3 pairs, so essentially it's $120, and then 5-pack is $190, and we also offer a 7-pack. So if you do a full switch, right, you want to buy 2 weeks worth, right? That's more than plenty. And then you can swap them in and out based on color, right? But yeah,
Sure.
it is fairly expensive. I totally get it. But one thing that for us at Mr. Fertile, we're not here to be some cheap alternative. There's a lot of different brands that sell underwear, right? I don't have to list them all, but what we care about is making the best quality product possible. So if you want the best, you can come to us. But if you want an alternative, we're happy to direct you toward a healthier alternative compared to cotton, polyester, right?
Sure.
Again, that's the whole idea. We want people off of polyester, nylon, right? Heavy synthetic blends. It's not good for you. And I guess one question I wanted to ask you. So again, you're the expert here. I'm just someone that saw a problem and wanted to do my part in being a part of the solution. But
sure.
When it comes to polyester and things, how serious do you think this problem is long term, right? Because we haven't talked about the elephant in the room with polyester. It's microplastics, right? And microplastics nowadays, they're found in everything from human placentas to sperm cells, right? It's incredible how it's everywhere. And I'm very, very shocked in terms of, right, more and more people are finally realizing, and this is a growing trend, but how serious is this when it comes to fertility and long-term longevity?
Yeah, I think microplastics is up and coming. There was just a recent article where they found microplastics in follicular fluid retrieved at the time of IVF. And so this is a huge question because of the fact that no one obviously wants any microplastics coming into human reproduction. I don't think we know enough about it yet, but there's no question that the data on fabric for surrounding testicles is actually there. And, until I had met with you and, spoken to you while we've been conversing via email, and learned about this and delved into it a little more, I have to admit, I was quite ignorant about the impact of your clothing on sperm production, but it actually has a significant impact. It looks like, the heat regulation, which we talked about for years, because we tell our guys to sit on frozen peas all the time to keep the testicles cold. So the heat regulation is a major factor. And then on top of that, you've got the potential absorption of any chemicals, microplastics, and so on that are in whatever fabric you're wearing. And on top of that, you have this electrostatic charge mechanism. So there may be several different sort of methods or pathways through which whatever you're wearing can actually negatively impact your fertility. We don't have any data that I'm aware of for women, but I do need to look into that. I'm sure that's somewhere you're going to be heading next. But I'm sure if it's affecting men, it probably affects women even more because there's the vaginal tissues will come into contact and they are highly absorbent. So I wouldn't be surprised if moving away from certain types of female undergarments isn't something that's coming in the future as well.
Yeah, absolutely. Absolutely. And again, it's just a growing trend that we want to be a part of, right? It's something that needs more awareness. And the more awareness that we draw, or more companies like us draw, the more people can actually understand and make the switch, right? And the more people that make the switch, healthier people are. That's the whole idea. More natural conception, the beauties of life per se, right?
Yeah. Well, thank you so much for coming on. Just to let everybody know again, it's Mr. Fertyl, MrFertyl.com. And get yourself some of this very comfortable, very cool, very breathable underwear. If at worst, it's going to help keep your sperm get better and your guys will love it. So try it out, see if you like it. And Patrick, thank you for coming on our show.
Of course. Thanks again for having me.
My pleasure. Have a great day.
You too. You too. Thanks again.
See ya. Okay, so amazing, and I have tried them. They're actually pretty comfortable. I should get you a pair now. Although it would be weird if I bought you underwear. But you can get yourself a pair.
I can get myself a pair.
You can get a pair.
Yeah, I can get myself.
Yeah.
Although,
so I'm sure we have like 5 million questions.
You have questions.
Yeah.
You have questions.
That guy is just wiggly.
I actually called the manufacturer on it.
Oh yeah.
I should have just returned it straight. And just got another one, but instead I wanted to do the the friendly thing and actually
I think you just need to tighten up the.
No.
It's just hopeless.
It's just hopeless. Yeah, it's just hopeless.
All right, fire away.
All right. Hello, Dr. V.
Yeah.
Can you please speak a bit more about Tacro for RPL or endo patients? Does it help above and beyond prednisone and intralipids, and does it carry any risks? When do you stop? Thanks so much.
Okay, so Tacro is useful for patients who have elevated cytokines. So TNF alpha, the interleukins, in particular IL-6, IL-10. So if you have the elevated cytokines, there is no question that you need to have that dealt with. And so we will use tacrolimus for that. We also use tacrolimus automatically for our endo patients, regardless of their cytokine levels. So we're quite careful about that to make sure that those patients are getting it. With endo, it's almost a doubling of the live birth rate, so it's very significant. And with regards to its impact on patients with just elevated cytokines, it depends on which of the 10 million studies that are available you read, but there is a suggestion that it definitely improves live birth rates there as well. So those are the two groups we use it for. When do we use it? Well, there's no great science behind this, so I do kind of have to guess a little bit. So traditionally, we start about a week in advance. And as long as it's a week in advance, we're doing fine. If it is high cytokines, like really high cytokines, or we've got like a stage 4 endo patient or something, those ones we might start a little bit earlier. So we might start those ones more around, like a month in advance or 2 weeks in advance before we're getting to the point of the embryo transfer.
Hi, doctors. Oh man, I am zoomed in so much. Hi, doctors. You're on camera right now. Our nurse mentioned that timing doesn't impact the efficacy of ovarian PRP. But is there any concern with doing it later in the cycle when follicles may be larger? Could that affect the procedure technically or in terms of results? Also, is it possible ovarian PRP would be canceled if there's cysts or endometriomas? How long before the ovarian PRP should aspirin be paused, and why? And how effective is ovarian PRP?
Oh, that's a lot of PRP.
There's a lot in there. There's a lot in there.
Okay, so let's start in reverse order. How effective is ovarian PRP? We actually don't know. To date, there are 3 well-done studies, 2 randomized controlled trials, 1 kind of descriptive study. The descriptive study said that there was somewhere between a 13 to 15% increase in live birth in patients that did the ovarian PRP. And it was done by a very reputable author, Richard Scott's group. However, it was just purely descriptive. But when you look at the data from the 2 randomized controlled trials, one trial showed no benefit whatsoever. The other one showed more eggs retrieved, but no increase in the live birth rate. And so we don't know that it actually works all that well. And I'm very upfront about that. I had a call just before I finished work today. Spent probably about 45 minutes on a Zoom with a family in Ottawa who is doing like cycle after cycle after cycle. Age was definitely a factor. And she said, I want to do ovarian PRP. And I said, I don't really think it's going to work for you, because when your age is that much higher, it's not really going to make a big difference. And there are no studies anywhere to suggest that ovarian PRP makes a difference with egg quality. Now, there is one very well-known doctor who I had a very negative interaction with, who strongly promotes ovarian PRP as part of a process to try and, I won't use the word because it'll give it all away, invigorate the eggs. And that doctor claims that it works, but there is no evidence to support that it actually works. And if he's so sure it works, where is his randomized controlled trial? He doesn't have one. So I'm not sure that it actually works. I'm not convinced. I think it may work. And when it works, at least when we've seen it works in younger women who have diminished ovarian reserve. There, I actually think it does work because I've seen it work. But if you're 44, 45, 50, 48, whatever, it's not going to help you because you still have to make so many eggs to just get one normal embryo. it's not going to make you make that many eggs. You're only going to get a couple more if it's beneficial at all. As far as when do we do it, we tend to do it once the normal follicle in your monthly cycle is a little bit bigger, just because it's easier to actually get it into small ovaries. And it's not an easy procedure. It's kind of terrifying because the ovaries are small. Sometimes they're drifting into la la land. You can't even get to them. And we got to stick a needle in there, and you can't. If the ovary is too far away, it hasn't come down towards the vagina, you literally are going to hit bowel. You hit the bowel, you've killed the patient. So it's a difficult procedure, and you got to be very delicate. So if the ovary is a little bit bigger, it's a little bit better for us. The final thing is, could it get canceled? Yes, I have literally drawn the PRP, processed the PRP, put in the ultrasound and said, your ovaries are unreachable. I can't do it. And after that, we changed our protocol so that we scan people first now. But yeah, there are times where we just can't do the procedure because it's not going to work. I can't get to the ovaries. So yeah, that has happened, I think, twice now or 3 times now. Once or twice we've managed to do it by bringing them back. The other times I said, this is not a doable procedure. So I hope that answers the question. Don't jump into PRP, and be very wary of anybody that's pushing something without clear evidence that it actually works, which is why I'm like brutally honest with people saying, I don't think it's right for you sometimes. And I'd say probably, I don't know, I only actually suggest to people they do ovarian PRP about 20% of the time. 80% of the time, people just don't qualify. They're over 40. They need 20, 30, 40, 50, 60 eggs to get one live birth out of it. And PRP isn't going to get you there. So, you have to have very frank, honest discussions with those people.
A bit better, but I need to zoom out one more time. Dr. V, NT. Yeah. Oh, you know what? Here we go. Here's a good idea. Yeah. Other way. A little bit. All right, good. Now go this way. I crookeded myself. Yeah, a little bit. The other way, a little bit, slightly. I'm having a good time here. Okay, that's good.
All right, go ahead.
All right. Now that everyone can see me.
Yeah.
Dr. VNT, do you ever use Progoverse?
Pergoveris. Yep.
Progoverse, yep.
Yeah.
If not, why is it not preferred? Thank you for doing this weekly show. It is really special.
Aw. I do use Pergoveris. So for those of you that don't know what Pergoveris is gonal F with recombinant LH called Luveris built into it. So it's the two together. I got nothing against it. It's a decent product. I like using gonal F a lot. It's kind of our mainstay drug. And we tend to mix it more with Menopur, only because there are some studies that showed that Menopur is beneficial in terms of impacting egg quality. But in a pinch, there's nothing wrong with Pergoveris, and it is very inexpensive compared to the other drugs. So I'm quite fond of that. I am hoping, beyond hope, that very shortly we will have our new protocol in place, which requires no drugs whatsoever at all. 0. You don't need even a trigger shot. And if that works for us, hopefully we'll be changing the face of fertility forever. But we'll know that soon. So we're going to start as a research project, trial it with patients that are willing to jump into that, see if that works. And then we can talk all about drugs after we know if that works or not.
Dr. Victory, do you allow your patients to still be breastfeeding for a transfer?
No, never. Your prolactin level being high suppresses your estrogen. And we know that it's detrimental to the success rate. So that just doesn't make any sense. It's relative birth control, which is why people have a harder time conceiving when they're breastfeeding. Why would you think that an embryo transfer will succeed? So no, we don't allow that.
Do you do self-referrals, or do we have to get a doctor?
Well, if you're coming from outside of Ontario, you have to get self-referred. If you're coming from inside of Ontario, you can self-refer. It has to be for IVF, in which case we can charge you for the referral. But if you're coming for anything not related to IVF, you just want to know about your fertility, please come with a referral, because otherwise it's quite complicated. If there's special circumstances, reach out to me and let me know, and I can always figure it out.
The sound is incredible today.
There you go.
There you go.
Woohoo.
That's-
Because we picked the right mic.
Because we picked the right mic. That's right. That's right.
Yeah.
Doctors,
Yeah.
glad you're back. What probiotics do you recommend for pregnant women? Can vaginal probiotics still help if you had dysbiosis prior to getting pregnant?
Yeah, we encourage our patients to stay on vaginal and oral probiotics. I don't necessarily know that any one of them makes a difference over any other. We do tend to use a lot of this NFH product called Flora. I'm not a microbiome product expert. I'm good at knowing the microbiome, but I don't know a lot about the products. In Ontario, we're not allowed to support one product over another, which is why I never kind of talk about I use this drug or I use that drug or this probiotic or not. Like, we can use whatever the patient wants to use. That's why if you want to use Pergoveris, use Pergoveris. If you want to use Menopur, use Menopur. Like, we don't push one over another because we're actually not allowed to. If I could, I probably would talk about specific products, but we're not allowed to. So I'm kind of neutral about all that stuff. Unless I know there's a test or a product that's garbage. If I know it's garbage,
Then
I'll tell you,
know.
like the ERA test. Otherwise, I'll just be neutral about it.
A comment that you'll love to hear.
Yeah.
I missed to see you at the fertility show in London.
Oh my God, you must be awake at 2 a.m. That's crazy.
Will you be coming back to London anytime soon?
Yeah. So lo and behold, what I didn't know was that in reading the fine print yesterday, when I get my UK license, I actually have to be in the UK to meet them in person. They got to prove that you're you. And in order to prove that you're you, you got to be you in person.
No kidding.
Yeah. So now I got to fly back to London for.
Maybe I'll go with you.
You might come
You'll
with
be
me,
you
yeah.
and I'll be me.
And you'll be you. Yeah. So yeah, I will be back. And if I get my license, I'll probably start doing consults the very first weekend I go back while I'm busy setting stuff up. So yeah, we're gonna be back on a regular basis, assuming they grant me my license. Yeah.
Dream team.
I love that
one. When could you come off estradiol in an FET endohistory excised? Lining was fine. Clinic added it, hoping it comes off, but wondering if there's a threshold to test or a week to stop early.
Well, when can you? Most people would probably say as early as 6 weeks. When should you? We keep our patient, if they're on it, we just keep them on it. We don't take them off until like 10, 12 weeks. But you could as early as 6. And we used to do that a long time ago. I just like first trimester stability. There's no evidence for when to come off.
Dr. V, I had a reader whose doctor was a part of your UK conference, and they've got a new insight. Endo wasn't being looked at the same.
Oh, wow. That's pretty cool. I like that. Making changes. Yeah. That's pretty cool. There's a great study, which is on our endo video on YouTube, by the way, which is called What the Doctors Aren't Telling You About Endo, right?
Yeah.
Something like that.
Something like that. That's
so check out that video. It's a good video. And in that study, they actually took women who were using donor eggs. So these are eggs that have no exposure to endometriosis, at least in theory. And the sperm obviously is not exposed to endometriosis. So they took the sperm, they took these completely non-endo touched eggs, and they made embryos, donor egg embryos. And then they took them and they put them in patients with endo and compared that to the outcomes for patients that don't have endo who are also using donor eggs. So if endo doesn't matter, which is what all the doctors love to tell people, then that means that if you're using donor eggs and you're putting those donor eggs in a patient without endo and you're putting it in a patient with endo, you should get the same outcome, right? Because endo doesn't matter.
Yeah, endo doesn't matter.
Right?
That's
it should be
theory.
the exact same. Okay, so you get a reduction of 46% in the patients that have endo compared to the patients that don't have endo.
Big number.
Huge, right? Half.
Big number.
Half the patients will succeed. So of course endo matters, and they're just being gaslit left, right, and center. And it was actually depressing and and at the same time kind of reassuring. As I was giving my endo talk and I kept saying, of course, endo matters, all these people in the audience just kept bobbing their heads up and down. And I was like, yeah, they're getting it, right? And then we just got inundated with people coming and saying, that was a great talk. No one will listen. I keep telling them I think I have endo. So, and then I kept getting it on social media too. So if you have endo and your doctor is telling you it doesn't matter, your doctor is either not well versed in endo, possible, and I guess I think it's important they should be, but whatever, they're not, or they are too stubborn to accept that it is, or they're lying to you. But it's only one of those three options, right? They're either not well versed, they don't want to change what they do, or they're aware and they don't want to tell you the truth. But and I'm not making any judgments about anybody specific. I'm just saying those are the three possibilities. Hopefully it's never the last one, but maybe they just don't know. I don't know how you wouldn't know, but maybe some people just don't know. But there is no question that endo matters. Endo matters.
I concur with you, Dr. Victory. Dr. T gives his stamp of approval.
Yeah.
Endo matters.
Endo matters.
Any tips for Lovenock shots? Is ice okay to use? Should I get rid of the bubble? And do I push until the safety mechanism engages to make sure I injected everything? Thanks.
Ice, yes. Inject all the way till the safety thing triggers. Yes. Is there anything else? Pull back on the syringe when you first inject so you make sure you're not in a blood vessel, just because then it causes massive bruising.
Good old-fashioned advice.
Yeah.
What protocol should you do for ICSI if the endometriosis has been removed recently?
What protocol should you do for ICSI if the endometriosis has been removed recently?
That's the question I got.
The only thing that's ever been shown to be beneficial prior to stimulation is tacrolimus and Vizan. Nothing else has ever been shown to be beneficial prior to stim. So we do recommend some common sense stuff. Again, it's on our endo video. Don't use a high dose stim. High dose is terrible. Same couple I spoke to today was on like mega doses of medications. I was like, that doesn't even make sense. And then they were getting a dual trigger as part of a duostim, which you can't do when you're doing duostim in the same cycle. So don't use high doses. Most of us will use an antagonist protocol. Take priming because most of you will have weaker ovaries. The more I've been researching this recently, I am convinced 100% that the rate of decline of your AMH is probably one of the best predictors of endometriosis. Because you talk to the endo patients and they're like, a year ago, my AMH was 20 and now it's 10. And I mean, that's not normal, right? But then you find out they have endo. And normal women, they're not going from 20 to 10 in 2 years. So I think that there is definitely some stuff you can look at there. And making sure you're on the right protocol. So make sure you're getting priming. We use DHEA, we use testosterone, we use human growth hormone. Don't take estrogen. Avoid birth control pill ahead of time. Definitely don't use Lupron. Shown to increase the duration of the stim, the amount of medications you need, and reduce the number of eggs you get. So be really careful about how they're managing you.
People like the idea of the natural fibers for the
undies.
Underwear,
listen, I'm not gonna lie, they're really comfortable. They feel really like silky soft. It's kind of a cool fabric. So
I actually recently found out, because these days everything is like this, like athletic materials.
Don't do this when talking about the.
I'm not talking about underwear right now. I was actually going into socks, but obviously. Oh, what time is it? 8:45. Oh, Fertility After Dark. So it's appropriate to be honest, but it's just might not be the best timing. So, anyways, whatever socks. So, anyways, all of a sudden, I started getting like this like rash on my foot.
Yeah.
Suddenly, like all of a sudden, I have like this reaction, and I'm like. What is that? And I have really good water at home. I have soft water, so there's no.
If anyone's got good water,
so I got good water. That's
yeah.
right. So I don't have any dry skin or anything. But suddenly I just have this like itchy irritation. I'm like, what is it? I suddenly got allergies. So I go to one of my friends. Obviously, a lot of my friends tend to be doctors, I guess. So I go to one of my friends. I'm like, hey, We're just sitting down having coffee. I'm like, what do you think this is? I just whip my leg out and I just show him my foot. So it's allergic reaction. I'm like, bro, I'm like 40 something years old. I'm not allergic to anything. He goes, maybe you're allergic to the material in your sock.
Really twigged into that one.
Then I said to myself, okay, let me dump all of these quote unquote athletic socks and comfy socks, and because then I started looking at the materials in them, because now I went to the deep dive, knowing we have this whole bamboo talk. So I'm like, oh, maybe I need bamboo socks. Maybe there's something to this. And sure enough,
yeah,
a lot of people have these allergic reactions to these synthetic materials on their clothing.
Really?
It became like I went on Reddit and it's like, everybody's got this problem. I'm like, unbelievable. So for sure, on the undies, I bet you it makes a difference for the boys.
I don't ever get an allergic reaction to like materials. I can't say, but I get it. Like, I wouldn't be surprised if people do.
Never in my life have I.
Yeah.
But I guess, but you know what? Because what happens is you go to Costco. I have kids and a wife and whatnot, right? So we go to Costco. It's a good value, and they got these like packs of socks.
Yeah.
So we're just stocking up on socks.
Yeah.
And
you got a rash.
I finally.
You should take them back to Costco. They take back.
Gotta take them back. I should. You know what? I should take back the whole boatload of socks we got from these guys.
Now, did the kids have a reaction?
No. I guess I'm sensitive to my old age.
Wow.
Seems to be.
Interesting. Cool.
Seems to be.
All right.
A little bit of a tangent there. Sorry, guys. Sorry, everybody. Okay. Back to the questions. Are you going to? Oh, I guess the question was, are you going to make ladies' underwear? But you and me are definitely not going to make ladies' underwear.
Well, I suspect that he will eventually make ladies' underwear. And if you really think about it, and I never thought about it until I started reading about electrostatic charges and stuff like that, but like your very sensitive, very absorbent tissues can, although I'm sure they don't all the time, but can come into contact with the material, right? Especially if it kind of wedges, which it often does. So, like, that's very absorbent for a woman and in a very absorbent place. So I think having more natural fibers really helps. When I was in residency and we would get women who had what we call ISV, which we, called what is now termed itchy, scratchy vagina. We just called it ISV. So when you had ISV, first thing we would tell everybody, wear white cotton underwear, no dyes, no chemicals, no synthetics, nothing, just white cotton. And it helped relieve a lot of people. Get rid of detergents that are harsh. Tide is like the number one most allergenic detergent. So we tell them to stop using. And like many of the women would come back a month or two later and they're like, perfectly fine. I'm fine now. The ISV is gone. It's powerful stuff. And you don't think about it. You go to the store, you find a nice item of clothing. Hey, I like it. I'm going
100%.
Yeah.
Who's reading the back of fabric? I have enough time with make sure there's no pork in my food. Forget about fabric in my materials.
That's half of our night together. I gotta call him. Tarek and I eat before every show. I'm like, is there any pork in the food? No pork. All right, next.
Yeah. Hi, Doc. I'm having some spotting 6 days past IUI. Could this be from progesterone suppository?
Could it be? I guess so. I'd be wondering if you nicked yourself or something like that. You should not really be having spotting after an IUI. Get checked out.
Hey, doctor. I've had 3 chemicals. I did the recurrent loss panel and sono, all came back normal.
That's it?
That's what I got.
I don't know what recurrent loss panel you did. I would need more details. Please DM me and I will be happy to guide you.
When does lab usually start to thaw blast before transfer? Saw your 2 to 3 hour speed success video.
Yeah. We do it about 2 hours. So that's roughly where we're looking at it. Sometimes earlier, but generally around that time.
Hi, doctors. I have 3 ectopic pregnancies and 3 failed transfers. I will be coming to you.
Excellent. And I'm so sorry that you have 3 ectopic pregnancies and 3 failed transfers. 3 ectopic pregnancies and 3 failed transfers. I would encourage you very strongly to, even before you get to us, do microbiome testing, because there's got to be something infectious or inflammatory. Maybe do your immune as well. There's going to be something there for sure. Yeah.
Can surgery cause flare-ups with endometriosis?
Not that I'm aware of. I mean, it shouldn't. So no, I wouldn't think so. I've never read that before. Good question. That was like a stumper.
It was the longest minute of silence the show has ever had.
I don't get stumped, thankfully, too often, although I do get stumped from you guys, but I've never been asked that before. I guess it would depend if you're referring to endosurgery or just some other surgery. So if you're asking if, like, I don't know, you have a breast augmentation, can that cause an endo flare? I wouldn't think so, although I guess the healing process would activate your immune system, and your immune system is overactive in endo. So maybe, I've never read anything about that, but I can see how that might happen physiologically, but not if you're having endosurgery. If you're already getting endosurgery, it's highly unlikely that the surgery will reactivate the endo because you're getting rid of it.
My lactobacillus has been chronically low. I feel like 4 weeks off won't be helpful for my FET.
Like 4 weeks off? If your lactobacillus is chronically low, there must be something there in its place, which you have to kill in order to make space for the lactobacillus. So make sure you know what you need to kill off. I had another patient, actually two, while I was in the UK at the fertility show, who showed up with results from another company who constantly likes to tell people that the uterine environment is sterile. And they were like, look, I have nothing. And I was like, no, that's not possible. The test is like faulty. So if your test from a specific company shows that you have nothing, like no lactobacillus, no bad bacteria, you're just blank, there's nothing there, you have a quote unquote sterile uterine environment, get a different test from a different company. That company's test sucks.
The one viewer is asking, what test should I do that the doctor told me to do? She's the one with the three failed ectopic pregnancies and 3 failed transfers.
Yeah. So, we use Fertilisys, but I don't care which company you use. So for you would need Victory Panel 2 if you want to communicate with them. It's a full autoimmune and alloimmune panel. So it looks at your NKs, your Tregs, your NK aggressiveness or cytotoxicity. It'll look at your cytokines. It'll look at things like your DQ alpha match, KIR, LADs. It's got a bunch of stuff. And you need a full microbiome. You need an evaluation of the shape of your uterus. And you need your partner's sperm tested. On top of that, we need to look at your health, vitamins, thyroid, hormones, BMI, social habits, smoking, drinking, drug use. All of that stuff's important.
Dr. Victory, I have PCOS and was wondering, what does high androstenedione do? That's right. I've been TTC for 26 months now, normal weight and a high AMH.
Yeah, so there's not a ton you can do other than maybe take letrozole. You can't bring down your androgen levels without taking an androgen blocker. The other thing you might want to try is metformin or something like inositol. And then there are some studies that suggest that PCOS women will actually benefit from taking dexamethasone. So that might be worthy of investigating further as well. And I think we will probably soon start using dexamethasone once I do a bit more reading. So don't call and beg about it. I'm not sure yet, but I'm going to read a little bit more about Dex and consider using it. It looks like it may be beneficial during stims. I need to read more.
Master T.
Wow.
Please ask Dr. V. So obviously you're still the doctor here.
I'm still the doctor.
That's right.
here. Yeah.
No fear here. Do you think there might be some cases like a 41-year-old with history of a lead follicle where it makes sense to do some estrogen priming? Do you ever consider it?
Yes. In very rare circumstances, when I've tried everything else and I cannot get someone to not have a lead follicle, we will use estrogen priming. How often is that? Once or twice a year. out of 500 plus cases. So not often, but once in a while we'll do it.
I will tell you worse.
Uh-oh.
I went for a laparoscopy with a fertility doctor in Cork, Ireland.
Okay.
He told me there was no sign of endo. I felt like he wasn't being truthful.
Oh, that's not good. Wow.
Talked to another doctor into referring me, had another laparoscopy in Dublin, stage 3 endo wrapped around my bowel and bladder.
Oh, that's a lawsuit.
Doctor in Dublin said no way another doctor could have missed it.
Really? That's terrifying. The amount of like, I don't know, it's a weird thing. Like the amount of lack of knowledge about endo, it's not good. Like I get the reasons why, and I mean the cynical part of me is worried about some of the reasons why, but it kind of, I mean, it kind of just bewilders me. Like how, when you go through your training to become a fertility specialist, a huge part of your training is endometriosis.
Oh, so it's not like this thing you just had a passion. Like it's a thing.
It's a huge part. And when you do gynecology as part of your training, endo is like a huge part of your training, right? You go to the OR, you see all these people with brutal endo. Okay, granted, I had a strong interest in minimally invasive surgery. And so I worked with literally one of the best in the world, George Vilos, who taught me how to do all of my surgeries. And like his cases were just psycho. I mean, we would be there for hours just peeling stuff apart, and it was a mess. And but I became a good surgeon because of George, entirely because of George. And so, you know, we learned it and we lived it and breathed it. But like, I can't imagine other people doing gynecology don't have experience with endo. So it's pretty crazy. I don't get it.
It is pretty crazy.
Yeah.
Dr. T even knows about endo.
Yeah.
You got endo, we got to deal with that first.
Can we just thank everybody for commenting as well today on our post about like things not to say?
Let's give a
I think we
shout out.
got huge shout out to all of you for commenting on our post about things not to say to someone who is TTC. And huge shout out to Tarek because he said, let's do this. And I was like, nobody's going to want to watch that, but it was a pretty good post. So I totally have to give him props for that one.
Hello, amazing doctors. Plural on the doctors.
Yeah. I love the fact that you're now recognized as doctor.
Oh, it's happening more and more often. Happening more and more often.
I'm going to make you a t-shirt that says, Dr. T, all the fame, none of the diplomas.
Yeah. No paper, just fame. Yeah. I'll wear it. I'd wear it. Can endo cause miscarriage at 10 weeks?
Yes. Yeah, endo is associated with an increased risk of miscarriage, probably through inflammatory markers in your immune system. And it's also associated with a higher risk of aneuploid embryos, depending on which study you read. So yes, it's a possibility.
My IVF baby is 8 months old now. Vaginal birth, no issues.
Cool.
Wondering what the timeline is to come see you for our next transfer. I will likely need endo surgery again with you.
Maybe a year is probably what I would be thinking. So if like not a year from now, I'm assuming you want 2 years between your babies. So somewhere around the year mark, come and see us. Book an appointment now so that you'll get it in about the year mark.
9 o'clock. Master T, please. Master, I set up the chair. I get too close, and then
you got too close.
I got too close.
Yeah, you're squeaky now.
I noticed. Part 2, please, about the estrogen priming. If Dr. V only does it 1 to 2 times a year, what does he do to avoid a lead follicle? 41 years old.
Testosterone, human growth hormone, it usually suppresses the lead follicle, so that works out fine for us. Plus DHEA. Yeah.
Dr. V, any research on ADHD medication impacting male sperm quality?
Yes. God, I haven't looked at that for a long time. My recollection is it actually speeds it up, but I will look it up for you right here, right now. So give me 1 second and I will tell you what it shows. How do ADHD meds impact sperm? So this app, which I encourage all of you who want to do your own homework to use, is called Consensus .app. And this is like an AI for people that want to do medical research. And it's awesome. May decrease semen volume and total motile sperm count, but methylphenidate, which is Ritalin, does not negatively impact sperm parameters and may even increase sperm concentration and motility, which is why I remember that. So it looks like some of them are not so great, and Ritalin actually speeds up your sperm. Please don't go on Ritalin to speed up your sperm. There are better ways, but it may actually improve things. Yeah. I guess the big question is, should we try giving that to guys who have crappy sperm? Interesting thought process there.
You can even just give them some caffeine. Just
Caffeine
speed
works.
it up. Caffeine
It does.
works.
Yeah, caffeine.
Absolutely.
2 to 3 cups a day improves the number of sperm you have that are swimming. Yeah. Probably reduces your count, though.
I have a post here on TikTok.
Okay.
I have endometriosis. He told me let's do a test. Like, I need endometriosis surgery. Can you read my question, please? I have to write in 3 different posts. I don't think I see the question. What is the name of the test? Oh, we said the test.
Yeah.
We said the test, right? Yeah,
Yeah.
we said the test.
Yeah.
Yeah, the microbiome test.
Yeah.
Yeah.
Fertility microbiome. Just tell them you want Victory Panel 2. Contact Fertility. Tell them you want Victory Panel 2. I don't get paid by Fertility. I have no financial arrangement with them whatsoever. In fact, I took them out for a very nice dinner the other night and I paid. So, but I love them. They're great people. And the test is just called Victory Panel 2 because they give my patients a discount for combining the test.
Dr. V and Dr. T.
Yeah.
Is NIPT needed if your embryos are PGT normal?
If your embryos are PGT normal? Yeah, technically speaking, no. But there's no harm in doing it other than financial. So if you want to get it tested, go ahead and get it tested. 904. One more question.
Okay.
Because we have to make videos.
I know.
Yeah.
Dr. V, do you recommend oral or vaginal probiotics post antibiotic?
Both. Always use both. Yeah. Easy question.
Well, fine.
Okay, folks. So we will see you next Tuesday, right?
Yeah.
We don't have anything going on.
We might have that guy.
Guy?
Vitamin guy, maybe.
Connor?
I think.
Oh, Connor's really cool. He's smart. Wow. Connor is a PhD, if I'm not mistaken, nutritionist who has created vitamins that he markets in the UK, but now he wants to bring them to North America. And they're really powerful vitamins. I sounded like Trump there. Really powerful. Yeah, he's a really nice guy. We saw him again here. I met him in Ireland, and then he was at our booth and gave us some samples to give to people and stuff. And so, yeah, really nice guy, super smart, beautiful Irish accent. Yeah.
Oh, cool.
Yeah. And has a super cute little baby too. So anyways, yeah, if Connor's coming, Connor's coming. I think we have a whole slew of people coming. We've got some naturopaths that are going to join us, like kind of bigger influencer people. And I'm trying to get in touch with some of the other people that I've started following recently. So we'll see. Have a great night. Oh, yeah. Wait.
Where should I call for the fertility test? Just looking for straight up.
Oh,
directions.
if you want to go for Fertility, go to www.fertilysys, fertilysys.com. So fertilysys.com, fertilysys.com. And they'll help you out. You can just email customer care at fertilysys.com. They'll give you all the info you need. Yep. All right. We're going to sign off because we still have to make videos and I'm still recovering from being in England. I hope you guys all have a wonderful evening. Thank you, as always, for watching. Thank you for sharing our posts, liking our posts, commenting on our posts. And should have said this at the start of the show. I'm so sorry. I was so blindsided in my love of the fact that we do a good job that I completely arrogantly forgot to mention the bombing. For those of you that are still watching, the horror of seeing that California Palm Springs clinic devastated is absolutely wretched. I want to rant for a second here because this is coming from rhetoric that is being used by imbeciles who want to drive a wedge between physicians and patients for no good reason whatsoever. These are people that are severely uneducated. They don't understand the material they are either listening to or reading. They think that they have the capability to understand the material, but they don't, which makes them dangerous because they're propagating and trying to promote ideologies that are fundamentally scientifically unsound. You want to have an opinion on something? Go ahead and have it. You think vaccines suck? Great. Have your opinion on vaccines. You think vitamin K is bad for babies? Huge mistake, demonstrably wrong. Great. Believe whatever you want to believe. But when you go on social media and you act like you know what you're talking about, and you tell women that it's okay to wait till 45 weeks to deliver their baby, or that vaccines cause autism, or you tell people that they shouldn't get oxytocin, or that the glucola drink, that's another one that's coming up soon, has, detrimental things in it. None of this is scientifically true. It's all invalid. It can be proven wrong in a heartbeat. And it's creating violent lunatics who are taking what people are spewing and then using it to go kill people, in this case himself, and then damage buildings which have embryos in them, for God's sakes. Can you imagine if the embryos had been against the wall, the kind of damage that guy would have done to people's lives? They could have lost their chance of having families. And this is all coming from these idiots who don't know what they're talking about and think that they know. It is the ultimate example of something called the Dunning-Kruger effect. And this is a legitimate thing studied at Cornell, proposed by this guy. And we did a post with John Cleese a while back, which was hilarious because I love John Cleese. He's a very funny guy. But he was being dead serious in this post. And he says, these people who think they're really brilliant are actually too ill-informed. I think he actually uses the word dumb. I'll refrain from that. But they're too ill-informed to actually understand that they don't have the capability to understand. Like, they can't understand that they can't understand because they don't have the wherewithal to understand that. And myself and a lovely, wonderful person online who helps me now with some of my social media posts and creates content for us, we're discussing with a guy who was just rambling and raving about every time I would say something. And this was a guy that started by saying that the COVID vaccine had aluminum and formaldehyde in it, neither of which it has. And I think he also said polysorbate 80, but it had none of the ingredients. And then when I pointed that out, he just went rambling on to something else. And then at one point called me Satan because I perform IVF without knowing a single thing about me or how we do IVF or how many embryos we keep or anything like that. That kind of rhetoric is going to get us all to the point where there is no one left who's practicing medicine. And I'm just going to throw this out there because hopefully Tarek will turn this into a clip. I'm going to throw this out there for all those of you who think that doctors are evil and everything's run by big pharma and that we got trained by big pharma and that we're in the pockets of big pharma and all this other nonsense that's thrown around like it's a fact when it's absolutely, completely untrue. Who is going to be left to help you if you eliminate all the doctors out there and you get cancer or you're having a heart attack or you or your family are in a car wreck and you need life-saving surgery? Who's going to be there for you? And with that, we will leave the show. I will see you guys all next Tuesday. Fertility Fact or Fiction and a little bit of a rant. Have a good night, guys. See ya.